So I've got a 23-year-old, 17, 15, and then the 2-year-old. Yeah, I've been kind of thinking about it since I've been doing this, and I'd never seen anyone breastfeed before. I wasn't really aware of it, but it just kind of felt natural and normal to do. And yeah, it went really well with him. That was my son, my 23-year-old. So he took to it really well. He was really greedy, but I had a lot of pressure from my friends to give up, so I give up more quicker than I'd like to now. We all had babies at the same time, kind of thing. It was strange that, but they had just a little bit before me, and they all formula fed and didn't understand breastfeeding. They didn't have a try, so they didn't get it. So I kind of felt uncomfortable a little bit around them, because they could speak to each other about how their babies were and sleeping, where I never had any sleep. But yeah, and they also wanted me to go out, and it's much more difficult to do things like that. He never took a bottle or anything, so it was harder to do stuff. So that's why I kind of gave up. And I was young, and I did want to go out as well. 8 months I did. It felt kind of right to stop, but only because I didn't have any idea on how long you were meant to feed a baby for. I'd have liked to have fed him longer now. He says to me now when I'm feeding this 2-year-old, he's like, oh, didn't give me 2 years, did you, Mum? Could have fed me longer, because I'm telling him all the time the benefits, why I'm keeping carrying on to try and, because they're the same. They live in this society, so they think breastfeeding's weird, and especially as she's 2 now. And I'm like, no, it's got this benefit, it's good for her, she's comforted. And then he's like, yeah, you didn't do me long enough, did you? He's only joking though. Alexi was born with congenital heart disease. Straight away was taken off me. I was told I wouldn't be able to breastfeed her. I had to have a section, so there was that space. And then they said, you don't know how poorly she'll be. Then she'll need the surgery. You won't be able to feed after surgery. And it was just really negative, everyone's position on it, and I really grieved that I wouldn't be able to feed her. And then I was lucky enough when she was born, and in NICU, a nurse there said to me, you want to feed, do you want to breastfeed her? Don't worry. She took the tube out, the woman. She went to the NICU where the nurses had been telling me, don't get her out, don't hold her, don't try and feed her, you'll confuse her. So she took the tube out and she said, Michelle's going to feed the baby, she's going to come back every time you ring her. So just ring her when the baby needs feeding, every 2 or 3 hours. And it was brilliant, and I just fed her then, from then on, just from her intervention. The rest of them were like, no, don't try and feed her. She's got the tube. You just pump and give it to us, because I was pumping. When you want to express, be warm, be comfortable. There was all different things, and every one of them, that room wasn't. It wasn't warm. It wasn't comfortable. It was dirty. It was tiny. But yeah, 5 weeks I did in that room, and it was like you say, that it's not nice. It isn't encouraged, I don't think, especially when you've got a sick baby and they kind of need it more, and it's not encouraged. I didn't do any real groups with my first at all, and because I never had any problems, it was very easy with him. With my second daughter, she was harder to feed, and I asked for help and I didn't really get much help. Once you've had one and they're like, oh, you've breastfed before, carry on. And I'm not very good at asking for help either. And I'm thinking feeding this newborn is different to how I fed my son, because it gets easier and they know how to position themselves. And then I was thinking, I can't remember the positions. And yeah, I don't think when you've done it before, I don't think they help you as much. You get some bad advice, I think, and I never asked much advice with him. because if I'd have asked advice, they'd probably say give formula, because that's mostly the advice people give, isn't it? Anyone like my family and friends, I never ask advice, but they give advice that gives some formula, and you're like, no. Yeah, I think it's support and understanding. If the midwives are so busy, aren't they, that they don't have the time to come and help you with positioning. I don't know. And then you have nipple problems, and I just think no one reassures people or says, oh, you know, that everything will be okay. This is just a bad day, a bad minute. It's just straight to, oh, do you want some formula then? There you go. It's just, it's the answer to everything. Your baby's not sleeping, here's some formula. You're in pain, here's some formula. Change more than anything is that attitude of breastfeeding is normal, because it's not that they never had any support. Most of my friends and family just said no. I am guilty of trying to hide it as well, because I'm quite shy. So I do feed her in public, but I try not to, which is bad, because I'm not showing anyone else that it's normal and it's good, because I know that people are embarrassed about it around me. What the funny thing is, though, I work in a breast clinic where everyone sees breasts morning to night. And when I had her, the Christmas after I had her, I went there for like the Christmas do before COVID hit, and I needed to feed her. And do you know what? Everyone was like, do you want to go in this room over there? And I was like, oh, if anywhere I should be able to feed her and no one bat an eyelid, it's there. But I couldn't, and no one was comfortable either. And I was like, oh, it's so bad.